I was in the Navy from 1969 to 1971. I was worked in aviation fuels, and also that's where I started kind of really being interested in photography. I was on my way to work one day on my bicycle, and I would ride from here into Lancaster to my job. I went from that stop sign, I turned onto the main road, and somebody was coming headed east, never saw me and hit me head on. And I wound up in the hospital for 3 months, had a broken pelvis, a broken femur, broken ankle, collapsed lung, a bunch of broken ribs, and a spinal cord injury. It was a very difficult thing because I was so active. I rode about 300 miles a week. Fortunately, that's probably what saved my life. I'm not sure, had I not been in that kind of physical condition, that I'd be here today. I was dealing with a pressure wound, and it kept getting worse. I have a great team at the VA. They recommended home care, and BAYADA was who they went with, and I was really happy about that. I've been ever since then. You're not always welcoming people into your home, but it's always nice when Reagan comes because we always feel like she's part of the family.
Growing up, I was surrounded by lots of strong women. My grandma is a retired nurse and my mom is an LPN. It was just always clear to me that nursing was a natural calling. Typically in home health, we see patients for 1 month or a couple of months, but it is not as common for us to be in for a year like I've had the chance to be with Scott. So it's been really great to have that opportunity with him to build a long-lasting connection. Because of this chronic wound that he has, there have been a lot of things we've needed to trial and error just to see what works best to help with his wound healing. So I always like to assess his wound and get measurements and just kind of track how it's doing. He started developing severe pain with the wound vac, and at that point I knew that it was no longer fair for him to continue with something that was causing such an amount of pain. It is very important for someone to be comfortable during their treatment to help with the healing process, so that's when I knew that I had to step in and help make some changes.
So we talked about it back and forth, we discussed it with the VA, and they said, yeah, it makes sense. It's not really doing anything. And ever since we took it off and started using another therapy, it's been healing.
I feel the need to be an advocate for my clients, particularly Scott, because he has been through so much in life. If me advocating for him and making sure he gets the right treatment makes his day easier, then I'm happy to do that for him any day.
I had the first nurse from BAYADA. They said to me, well, Reagan will be she'll be your case manager, but she's away right now. I said, oh, she's on vacation. No, they said she volunteered to go to Erie to open a new office and train some of the people there.
We opened an office in Erie, Pennsylvania, which is 6 hours from Lancaster. We had our first patient on schedule, and our preceptor got sick.
I kind of just was like, I don't know, maybe Reagan would go. She's so great with new employees. I called her and I explained to her what was going on, and she immediately, without even pausing, said, oh my gosh, that would be so exciting. I would love to go.
Our goals with BAYADA are to keep people safe in their home and out of the hospital. I knew that I would be helping colleagues that were banking on this office being opened in a certain time frame. So the more people that we can step in and help, the better.
She was there with not knowing anybody. Nobody was there to help her. She just came in, saw what needed to be done. And so for me, it was such a weight off my shoulders to have her there taking care of the nurse that needed to be trained, the patients, organizing the supply room. I mean, she really helped me out in my time of need. And truly, without Reagan, we would have failed at delivering on the services that we said we were going to provide. I think it would have really hurt our reputation. With her being there, it would have really allowed us to just kind of take off from growth from there.
Nurses who do home health care truly are heroes. She doesn't really think of it as being anything special. She thinks about it as that's what you do when you're a nurse, to take care of your patients, do the best job you possibly can, and every once in a while get a nice big hug.
I I feel like my patients are the true heroes in this situation. They inspire me every day to be a better person. Scott has taught me so much. He has taught me to be humble and appreciative. I truly admire his strength and his determination. I have never left a visit with him where he did not have a smile on his face. He has been through so many setbacks in life, and he's been presented with so many challenges. Just his perseverance to continue pushing through says so much about him.
Reagan coming in, helping him get better, I've seen him be able to get back to the things he loves. He's happier. She's made a huge impact on all of us. But for me, knowing that my family is happy and taken care of and getting better is the ultimate peace of mind.